explaining procedures and outcomes for obtaining informed consent is a routine now. But even then, even in my institute, and I'm sure many of our healthcare professionals find it very difficult to convey important information to the patient and family regarding these disclosure of major procedures, especially when there is an unanticipated change in plan of care, whatever the procedure it may be. So out of your very expert years of experience, could you share on how best we can disclose major procedures and at the same time also include patient in decision making? So over to you, Mohan, sir.
So we have moved from the era of telling patients, you just have to undergo this operation, because patients have become very smart. They've done all their internet reading before they came. So that era is gone. The best thing that happens now, I'm very happy about this in surgical branches, is when the patient comes for a surgery, first the consultation in the OPD where the decision is made is used to counsel and tell them this. Invariably, we'll find that they're confused. They don't know. Then as soon as the patient is admitted, a senior doctor comes and tells them with his assistants present, so that if he is not there, his assistants will be able to counsel along the lines the senior doctor has done. That is important because patients should not get mixed messages. And finally, now we are candidly putting the choices. You want this? Fine. You don't want this? Fine. We can do that. These are the comparative risks and benefits and costs. You choose. And so they choose. The problem happens only if the patient, like the rest of our country, comes from a poor background, where the patient is taken for granted. There is a real problem.
Yes, sir. That's very true because, again, judgment and assuming and assumptions. I even remember Dr. Kinsley during our master training course telling how we just assume looking at the way they dress. And that's another huge barrier to effective communication where we just have assumptions. So very rightly said. Thank you, Dr. Mohan.